Throughout North America every day, thousands of surgical procedures are performed utilizing the best technologies available to provide excellent care and outcomes. In Canada, every citizen has free access to this level of medical treatment when it is necessary. For people with a need for knee and hip replacements, this is as simple as going on a waiting list, knowing that they will get treatment that will provide significant quality of life improvement. For the vast majority of people around the world, this level of care and intervention can't even be imagined.
We're going to trade jobs here, man. Liz, you take these two. Yeah.
More than 10 years ago, a dedicated group of orthopedic surgeons, nurses, and therapists decided that they could make a difference for some of those people in less fortunate countries. OperationWalk began providing free hip and knee replacement surgery to people in need around the world.
Good hip over there. She doesn't have any hip here.
The spirit of giving new hope has recently expanded as new OperationWalk teams have been formed by other like-minded groups around the United States. In 2006, OperationWalk's first international group was formed. From Canada, surgeons Cecil Rohrbeck and Bob Bourne assembled a team to join the LA group on a mission to Guatemala. Guatemala, like many developing countries, has very sparse medical resources, and most live without even a remote chance to even the most basic level of care. While some 60,000 joint replacements are performed in Canada each year for a population of 30 million people, in Guatemala, less than 300 similar surgeries are done to help a population of almost 15 million. No waiting list, no help, no hope. Until now. The team from London, Ontario received overwhelming support from businesses in the medical community. All of OperationWalk's equipment and supplies are donated, and everyone on the team donates their time. After many months of planning, Team London arrived in the remote town of Antigua, Guatemala. On arriving at the Hermano Pedro Hospital, it was obvious that this was worlds apart from the level of need and care that is taken for granted back home. Wards were full of infants with severe conditions. Children lined the hallways in the permanent care of hospital staff. And hundreds of people lined up every day at 6 in the morning for the chance to see a doctor. This was an eye-opening scene for the team, and the real sense of purpose was taking hold. The first task was to decide who they could help. Some people traveled for as long as 14 hours in the hope of receiving these life-changing procedures. Families waited anxiously for their name to be called, their chance.
Ana Cristina Andrino.
Rosa Maria Varela.
Like this young farmer who, after a severe tractor accident, has been unable to walk or work to provide for his family. This would be a difficult case, as it had gone untreated for several years since the accident. There were many stories of daily pain and inability to do the simplest of tasks. There wasn't a lot of time to make the tough decisions as to who could be helped. The first surgeries were about to begin in just a few hours. With the information gathered, the team set themselves to the task of choosing who could be helped with their limited time and resources.
We looked, the smallest cementless we have is a size 8, it's too big. The cemented stem seems too big. We're going to get other x-rays, Jerry, I think, with some type of magnification marker just so we can assess it.
Back at the ORs, all of the supplies and systems had to be organized. In limited space, and with 4 ORs working simultaneously, the team had to overcome any and all obstacles. The first patients arrive at the OR, and the OperationWalk team begins what they came for. It is a true team effort. As the cases proceed, and without the benefit of large sterilization departments that they enjoy back home, the team needs to quickly sterilize all of the needed instrumentation to allow fast turnaround for upcoming patients. Soon, patients start arriving from the ORs to the wards, where many will share the same space, and where the team will make them comfortable and ready them for the next few days of therapy. These are motivated patients who are realizing a dream of being able to walk, pain-free. And so it doesn't take long for our first look at some of them getting up to start a quick recovery. It also doesn't take long for some special bonds to be formed, and the gratitude of these patients is special for their new caregivers too. On the first day after their surgery, all patients are up and walking and beginning to learn the exercise regimen that will allow them to make the best recovery with their new hip and knee joints.
Yeah, this woman was not able to walk before surgery, and she's got very severe rheumatoid arthritis.
She will walk tomorrow for the first time in years and years upright, and it's just a very rewarding experience.
Operation Walk provides a special legacy, education and training to the local medical community. Both in the ORs and at the bedside, Operation Walk team members share their knowledge and experience that will continue to help long after they're gone.
And this is contracted also. So when you do your initial exposure, it's very important to get to the back part of the knee. Okay? All right? Very important.
Within a few days, family members will have to take over as caregivers. The team's physiotherapists and nurses, with the aid of an interpreter, orient them on what to expect and how to help.
We do have a trial open if you'd rather not get the implant.
Nice to see you smiling. Good.
Some of the team's patients have made a real impact on them. Cesar stood out as the always smiling gentleman with the red beret.
Now we know who you are.
¡Qué guapo!
One day after his surgery, Carlos is up and walking. The transformation is incredible.
Wow.
That is really amazing.
After 4 days of surgery and more than 60 joint replacements, and just several days of therapy, the patients want to show their appreciation by walking to a common area to thank the team as a group.
Gracias, que Dios les bendiga.
It makes for some touching moments. Operation Walk London will be going back to Guatemala this coming November, when they hope to follow up with some of their patients and continue the mission with another week of surgeries. The team has been enriched by the experience. Gracias, Guatemala. Operation Walk Guatemala would not have been possible without the generous support of Smith & Nephew and the following corporations: we welcome your help in making a difference, one step at a time.